Hello. So the activity for this week is going to be an essay related to the idea of healthcare reform as a public health imperative. So what we're going to do is pull together some of these ideas that we've talked about this week, promoting healthcare, promoting a healthy living, and then take the question, should we do more? Should we have healthcare that is available to all? To minimize the inequities, to minimize the disparity we see in access to healthcare and kind of prognosis if an individual gets a disease, because there are big gaps in our healthcare setting right now. We've got a fairly expensive healthcare within the United States, but we're not necessarily providing good coverage for everybody within our country.
Increasing from about a life expectancy of about 45 upwards to about 80, 85 at this point up here. And if we take a look at the causes for this increase in life expectancy, we can see that there have been changes that have occurred, by science, by public health, and by a variety of other things that have improved living conditions. And so the kind of early kind of intervention, the early kind of changes that occurred kind of upwards to about the 1940s, 1950s, were mainly associated with declining early or midlife mortality. So, declining infant deaths, declining, the diseases that would cause families to have many, many children in an effort to hopefully have some that survive into adulthood. And so some of the changes that occurred, again, many of these are going to be public health initiatives, but, increased sanitation so that, we have sewer systems now that carry away waste materials. We have better access to housing and better conditions, more access to education for the improvement of opportunities, as well as a lot of reduced infections that have been associated with kind of a decrease, especially in early life diseases, early childhood diseases, both through the presence of vaccines and antibiotics over the 20th century. More recently, we've seen that we've pretty much improved the situation for early and midlife mortality, and so now we're seeing kind of improved medical interventions, cancer treatments, treatments for diabetes, treatments for chronic health conditions are getting better and better, and so because of that, we've got an improved quality of life and a longer life expectancy associated with that. So if we take a look at that, one of the major factors in improving life expectancy and improving public health has been availability of health care. And that gives rise to kind of a number of questions that we can ask kind of related to this topic. Here we've got the United States all the way out here at the edge. Along the x-axis, we've got per capita healthcare spending, and this is in 2015. The article I pulled was 2017. And so this is basically in excess of $9,000 per person spent on healthcare. And along the y-axis over here, we've got this health and access quality. So basically an indicator of the availability and the quality of health care that's available. And what we can see is that even though the United States has, by far the highest per capita spending, there are going to be a number of countries, many of which are in this blue region right here, that have better quality, higher access to health and access to medical care. Now, the ones in blue have universal health care, and so they've taken an approach that health care is a public health imperative, and because of that, they are investing resources in it to ensure that there is this kind of availability and access to basic health care throughout their population. Now, if we take a look at the United States, and again, keep in mind that this is looking at direct health expenditures, so paying for insurance, paying for out-of-pocket expenses associated with doctor's visits, medicines, things like that. There are also public health spending, and so this is making initiatives to promote a healthy lifestyle, to provide services in communities. And what we can see is that over the last 20 years or so, and this is showing 15 years on the slide, but it's the same pattern. We're seeing a general decline in federal public health emergency preparedness funding. And so this idea that the federal government providing resources to improve the health of communities. And this is only up to 2016. As we can expect, 2020 and 2021, we're probably going to see kind of a big upswing on that. But that illustrates what's going on the slide. In general, overall spending has been decreased, but we've seen kind of small amounts of additional funds, supplemental funds, well, not small amounts, large amounts, if you look at it, because it says per capita being expended per person. This is like $0.50, 50 cents per person, but you've got over 390 million people in the year living annually within the United States. So it's going to be a large amount. What we can see is that when outbreaks occur, when diseases occur, when situations occur, emergencies in essence, we see a bolus of funding that's being put into that to kind of make up for the shortcomings of the current funding situation. Now, if we take a look at public health and health within the United States, we can see that there are a lot of risk factors associated with it. And with these risk factors, there are a variety of them that are modifiable, that have the potential to be altered in some way. And the idea being that if you were to alter it, you may end up with a healthier population. So some of these risk factors that, again, can be modifiable, that can be changed under some circumstances, are a high body mass index, contributing, illustrating kind of the increased kind of weight that many people in the United States are experiencing right now. This contributes to things like high systolic blood pressure, so just high blood pressure, which puts a strain on your heart, puts a strain on your blood vessels, and it can also kind of disrupt normal functioning of certain organs. High fasting plasma glucose, this is either diabetes or prediabetes, that is associated with an unhealthy diet. And again, this level of glucose kind of disrupts the normal kind of mechanisms within the body and can contribute to long-term disease effects. There are also dietary risks, tobacco, smoke exposure, all of which are, ideally preventable. And so what types of things could we be doing to minimize or reduce these risk factors? And so we can see subsidizing availability of nutritious foods. There's been a lot of discussions about food deserts, but more recent research has shown that it's not a lack of access to healthy foods. In many cases, there are other things going on in that the healthier foods may be slightly more expensive, but the people in certain communities are not pursuing the nutritious foods and are, living an unhealthy diet. Disincentivizing the commercial production of harmful products. We've got things out there that are bad for us. Should we be promoting those? Should we, make them easily accessible? Investing in childhood education. This is a big public health initiative to lead to healthy exercise and dietary habits early on in an individual's life. Because if you can build those habits early, they're more likely to be carried on into adulthood. Taking a look at cities that are encouraging healthy behaviors. So in Philadelphia, you've seen kind of an emergence of parks, and those parks often have walking or bike paths that allow you then to get to them and get to other parks. And it's basically, there's a park along the Schuylkill River in which you can either walk or bike all the way up to Valley Forge National Park from Center City. And so that's an opportunity that's available. And then finally, we need to acknowledge that there are inequities in place that have really narrowed the path of better health. We've got, good access to healthcare, to doctors, to hospitals, to medicines, if you're in certain communities, but other communities are very dramatically underrepresented. Now, if we'll take a look at a few of these examples, this is taking a look, and this is kind of a follow-up to the food deserts idea. The food deserts are the idea that people in urban areas primarily don't have ready access to good grocery stores to have access to healthy foods. But more recently, and this is a 2018 article that's looking at this, what they're seeing is that even though the expenditures are about the same, healthy food is going to be a little bit more expensive than unhealthy food, people in communities are choosing not to pursue a healthy eating pattern. They're not pursuing a healthy diet. And so on this slide is basically by county analyzing grocery store purchases. And what you can see is that the lighter colors, like the light yellow and the white, are generally a better health of foods. So you're talking, the food pyramid, a good mixture of kind of healthy foods and kind of a lower amount of processed foods and fatty foods and things like that. The areas in the darker colors, especially the dark red, are going to be associated with a lower health index. So, higher fat diet, higher salts, higher processed foods. And what we can see again is that there is a huge disparity in the eating patterns as we look across the United States. Now, if we extend this to saying, okay, what happens if we are eating unhealthily? We can see, and this is the body mass index, so an indicator of kind of the relationship of weight and height, which has some limitations to it, but it is kind of a starting point. What we can see is that, in 1992, roughly 30 years ago, the amount of people that were experiencing obesity was in the range, and this is looking statewide, of about 10 to 20%. A few states a little bit lower. One state in here that we don't have any data for. 10 years later, in 2002, we're looking at the fact that this has changed. We've still got a fair amount that's in that 10 to 20% range, but over half of the country now is 20% or higher obese. And then most recently, the data that I could find, and again, this is a 2015 article, in 2012, taking a look at this, and this is now by county, which corresponds pretty well to this unhealthy eating pattern that we're seeing here. We are seeing kind of this dramatic increase in obesity, at least as it's measured by body mass index. And we're taking a look at this, just going in 20 years to go from this to that. You're seeing an increase of 10 or 20% of the population becoming obese during that period of time. Even to the point where we've got some blue counties showing up here, where it's 40 or 50% of the people in those counties would be defined as being obese, as being unhealthy or having an unhealthy body weight. Now, again, we can take a look at that in terms of obesity, but then obesity is one of those risk factors that we talked about in terms of health. And so this is a 2015 article looking at Medicare beneficiaries. So basically individuals that are 65 or older that have 6 or more chronic conditions. And if we take a look at that, basically if you have a chronic medical condition, you're at risk for getting a disease. You're at risk for that disease you get having a much worse prognosis. Your likelihood of recovering is going to be much less if you've already got these pre-existing conditions. And again, if we take a look at this pattern, there are some differences if we take a look at it, but it is very, very close to that unhealthy eating pattern data as well as the obesity data. And so this is still a correlation, but there's good evidence that all of these things are going to be interrelated. Now, to switch gears slightly, again, because we've been interested in viruses at this point for the last couple of years, last year at least. Viruses are also a concern in terms of public health issues. And somehow my slides are out of order, so I'm going to have to move some things. So how does the virus work? The virus is over here. It is spread, as we've all heard, from one individual to another individual. Could be spread by somebody coughing. It gets in the air, it gets inhaled. Some viruses can be spread off of surfaces. So, somebody coughs or sneezes and then touches a light switch or touches a doorknob or touches a railing on a staircase, that can then be picked up by a new person. And what happens then is that virus then can get into that individual's body. It attaches to the cells and basically takes it over and inserts in its nucleic material, its kind of information. We'll define RNA and DNA later on within this course. But it basically takes over the cell and makes the cell basically make more copies of it, produce new copies of the viral particles that then can be released and spread to other cells within the body or potentially spread to other individuals. Now, this isn't the end. We'll come back to this in a couple minutes. This is a slide, and I hate doing these, but this shows what happens if you have a disease and no one's getting vaccinated. So we saw that with COVID-19, kind of a rapid spread. This is if you've got some of the people vaccinated. So the dark blue are people that are vaccinated. It slows the spread, but once it takes off, it kind of gets out there. But this is looking at if most people are vaccinated. The disease can't spread because it can't go to other individuals. It can't go to people that are susceptible. They're not going to get the disease, and they are not going to spread it to other people. So again, spreading very rapidly through a population that hasn't been vaccinated, that doesn't have immunized. This is a group that's been vaccinated, has a response to protect them against the virus, but it still spreads to all of the individuals that are unvaccinated. Now, in this case, we've got a lot of individuals that are vaccinated, and so they aren't able to transmit the disease. So we can see the importance of vaccinations. Now, if we take a look at this, up until recently, the viruses that people were thinking about were mainly your ear influenza virus. Occasionally, measles and mumps and rubella and things like that when you're talking about early childhood vaccinations. But the disease that is spreading through the world, spreading through the United States, is generally going to be influenza. And it's talked about as a relatively mild disease, but it still causes lots of hospitalizations. It can still cause severe effects, mainly in young people or elderly people. So it has a burden, has an impact on those. But even with a mild flu, we can see there are estimated over 500,000 life years lost through the flu. Annually, we see about 3.1 million patient hospitalization days. If you ever got a hospital bill, that's expensive, and it's going to be coming either out of your pocket or out of your insurance company's pocket. In addition to that, roughly 30 million or more outpatient visits where an individual is going to the doctor and getting treatment for the disease. So if we take a look at this, we've got a nice little pyramid kind of illustrated here. You've still got a large population of individuals that, have a mild case of the flu. They may be sick for a day or two, but really not be affected. But it's only when you start to see individuals with kind of greater risk factors associated with it, or other things that have contributed to the disease being more severe within them. And so what you can see that as the severity of the disease gets more and more kind of harmful to the individual, you can see an increase in hospitalization, and in the very severe instances, influenza can cause death. If we take a look at the economic burden, it's estimated that it costs about $87 billion a year, $87 billion with a B, dollars associated with influenza. Of that, about $10 billion is associated with direct medical costs, another $16 billion for lost earnings, as well as loss of productivity and a variety of other things. And so you can see that there is still a heavy health burden, public health burden, associated with influenza, which in many cases is recognized as a relatively mild virus. It gets more severe in some years than others, but it's nothing close to what we're seeing with COVID-19. Now, despite the health and economic advantages of getting the influenza vaccination, at least previously, and this goes up to 2019-20, So, pre-emergence of COVID-19, what we can see is that less than half of the population in most circumstances is getting vaccinated. And so if you think back to that slide, looking at the spread of the virus through a population, the higher amount of vaccinated people, the higher amount of people that have immunity or kind of this ability for their bodies to fight off of the disease, either because they've been exposed to it previously through a vaccination or they've had the disease before by getting sick with it before, until we have that kind of large population that is going to be and I want to say immune, but basically kind of protected against the virus, it has the potential to spread. And so, despite all of that information, we can see, again, disparities between different populations, but no population. We got 1 year where the white non-Hispanic is 52%, just slightly over half. But the vast majority of this is well below what we would hope to be. And so if we want to try to minimize the spread and minimize the impact of the influenza virus, the flu virus, impacting society in the United States, we would need greater vaccination rates. But at least at this point, we haven't seen that occurring. Perhaps after COVID-19, we're going to have a different response to vaccines and immunizations. So for the assignment this week, what I want you to do is consider, should universal health care be adopted within the United States? And so just an introduction to this, control of the spread of disease is a public health priority that, if not managed, can have detrimental effects on society, including the risk of death, loss of work productivity, and economic disruption. At some level, preventative health care, and we've seen a move towards that with a number of insurance companies now, preventative health care can contribute to a healthier society. And that healthier society is defined as healthier because they're better able to fend off a disease. But the flip side of that is that if you have limited access to health care, you're going to see many people gradually becoming unhealthier. We see that with the increase in the body mass index, as well as the comorbidity pattern that we looked at on previous slides within this introduction. So people are becoming unhealthier. This leads to a progression of pre-existing conditions that make these individuals more susceptible to catching a disease. And if they catch that disease, then they will often have a poor prognosis for recovery. And so the question then becomes, should universal health care be adopted by the United States? If universal health care, basically if health care is a public good, then should society provide a standard of care to all individuals? Related to that, we're hearing a lot now about a minimum wage to provide, a living wage for all working individuals. Should America have a minimum health standard similar to the minimum wage that provides kind of basic coverage, basic preventative coverage, basic maybe large event coverage, big disease type coverage? Should there be standards that are for that? If universal health care is limited to basic medical, again, that idea of a basic minimum health care standard, to doctors' visits and medicines, or do we extend it to other resources that contribute to a healthy population? And so we saw the effects of the improvement of nutrition and sanitation, access to clean water, access to clean air. All of these things contribute to the overall health of society. Should our view of healthcare be limited just to doctor's visits, or should we, work at trying to becoming a healthier kind of environment for us all to be living in? Should there be incentives to healthy living? You take a look, my insurance plan provides me reimbursement for a gym membership. Now, it doesn't cover all the expenses for a gym membership, but, it makes it a little bit easier for me to be able to do that. Are there incentives that, encourage people to, become more active, to, get involved with a
a weight loss program or an increased activity program. And so, providing incentives to undertake a healthy lifestyle. Or, kind of the flip side, do we do the carrot or the stick? Should there be penalties for unhealthy living? Should we, we've got taxes on tobacco that provide funds for research on tobacco-related diseases. We see that within Pennsylvania. So we're, taxing people that are smoking. So there's already a penalty or a disincentive that is present with that. Should there be other, kind of greater penalties to, I don't want to say penalize, penalties, I guess penalize, but to discourage people from undergoing some of these unhealthy kind of patterns of life. As always, if you have any questions, please feel free to email me. Additional information on this will be available on Canvas. So thank you and have a great week.